RBMO Hot Topic Selection. Modelling the equilibrium partitioning of low-level airborne volatile organic compounds in human in vitro fertilization laboratories by John Fox, Pan Ni, Alicia Urrutia, Huey Huynh and Kathryn Worrilow. The potential impact of volatile organic compounds on ART outcomes has been speculated since the 1990s through correlational and anecdotal studies. In this paper, the authors have used equilibrium modelling to further our understanding of how VOCs could partition from the air phase and exert their negative influence. This is an important theoretical advance, and the findings have significant potential implication for laboratory practice. Can volatile organic compounds, VOCs, be modelled in an in vitro fertilization clinical setting? The study is the first known attempt to perform equilibrium modelling of low-level airborne VOCs, partitioning from the air phase into the oil cover layer, into the water-based culture media, and onto the embryo, air, oil, water embryo. The air phase volatile organic compounds were modelled based on reported VOC concentrations found in modern ART suites, older IVF clinics, hospitals, as well as 10 ppb and 100 ppb for all compounds. The modelling was performed with 23 documented healthcare-specific VOCs. The results of the equilibrium partitioning modelling of volatile organic compounds provides fundamental understanding of how airborne VOCs partition from the air phase and negatively influence human IVF outcomes. The results presented herein are based on the theoretical model, and the values presented herein have not yet been measured in a laboratory or clinical setting. Based on the partitioning model, 7 compounds, acrolein, formaldehyde, phenol, toluene, acetaldehyde, ethanol, and isopropanol, should be of great concern to the embryologist and clinician. These compounds are the VOCs with the most potent cytotoxic factor and the highest toxic VOC level in media. Additionally, ethanol and isopropanol are routinely found in the greatest air phase concentrations and modelled to have the highest water-based culture concentrations. High air phase concentrations and toxic levels of VOCs in culture media are likely indicators of poor clinical outcomes. Based on this model, improved air quality in IVF laboratories lowers the chemical burden imparted on embryos, which supports findings of improved IVF outcomes with lowered air phase VOC concentrations. This paper was selected as a hot topic article by our editors for the October issue of RBMO. Read this paper in full, other specially selected Editor's Choice, hot topics and review articles, along with full issues of RBMO on the journal website.